How would you like to be able to see crystal clear without any contacts, without any glasses? LASIK may be the answer to that. So I've come out to Southwestern Eye Center with Dr. Diaz to get all the specifics on LASIK. Doctor, thank you so much for sitting down with me again.
Hello, thank you for coming.
Absolutely. So let's kind of get the broad umbrella about what LASIK is.
So LASIK is a surgery, a procedure that affords the patient the possibility of getting out of glasses and contacts and improving their lifestyle, not having to be dependent on these devices to do what they do on a daily basis.
So how do I know if I'm the perfect candidate for this?
Patients with healthy eyes that have otherwise don't have other diseases but that are active and want to have a more simplified lifestyle.
So now everything that we've learned, is this a safe procedure?
It's very safe. The technology and the procedure has evolved over the years, and the current lasers are extremely safe, extremely effective, very precise, so the outcomes are great. As
you were saying, it's kind of progressed over the years. So what does it entail now?
So currently, most surgeons, including at Southwestern Eye Center, we use two different lasers, one that produces the flap and the other one that reshapes the cornea to get rid of the prescription. And so it's about a 5-minute procedure per laser, so it's rather quick in terms of the overall procedure, and then the patient starts seeing almost immediately once they get off the bed.
Wow. Coming from someone that's been wearing glasses since the 3rd grade, that would just be amazing. But is there any risks that possibly are involved with this?
Yeah, as in any other surgery, there are risks involved. The risks are mainly infection and inflammation, but we prevent those using drops, antibiotics, anti-inflammatories before, during, and after the procedure. So it's extremely rare.
That's good to hear.
Yes.
I'm sure you probably have heard this a lot. A lot of patients ask if these effects ever wear off from the procedure.
A lot of patients ask me that, and LASIK, the procedure, the effects of the laser do not wear off. What happens in some patients is they continue to get progressive nearsighted or farsightedness, just as patients did when they started wearing glasses at the age of 10, maybe at 12, 14, 16, 18, they needed stronger glasses. Well, the eye can continue to grow and change shape, so a patient may need further glasses or treatment in the future, but we try to avoid that by doing treatment on patients that have stabilized, so their glasses or contacts haven't changed in 2 or 3 years. The chances of them changing in the future are very low.
And I've been told that also, that they need to make sure that your prescription hasn't changed, so we give it a better chance, like you said, of your eyes not changing in the future.
Sure.
Now I'm going to dive a little bit deeper in there into the actual procedure. Do you ever use like different lasers per what each individual needs? Or I'm totally getting, into stuff I don't understand, but is there different lasers?
There are different laser platforms, but by and large we use the same laser on our patients, 2 different lasers that we use based on the technology that we've picked and the outcomes that we desire. But there are many different lasers out there, but the ones that we use we feel give the best results.
So is there ever a blade that's ever used?
A blade has been used in the past to create the flap, and some centers still use it, so that's an important question, is whether or not a blade is used, because the complications, of course, of a metal blade going across the cornea can be extreme, severe, and so we recommend trying to we recommend not using the blade for those procedures because of that.
I've heard like exactly what you're telling me. I've heard that also about the blade and the effects. I'm so glad that I asked that question today. And coming out here and being educated about stuff, I know there's refractive lens exchange. Tell me a little bit more about that.
So LASIK is a treatment on the surface of the eye, the cornea. Basically where we put the contact on is the cornea. And in some patients, it's better to do refractive lens exchange, which is where we go in, we remove the lens and put in an artificial lens, similar to what's done in cataract surgery. But cataract surgery patients have a lens that's yellow and opaque, doesn't let the light in, so they can't see well. That's why we do surgery. But in younger patients, some patients are better off getting this lens exchange. And a specific example is a 50-year-old patient that needs glasses for distance and reading. LASIK is not the best for that patient because they still would need glasses for reading. It'd be very difficult to get rid of their full prescription. So going in and removing the lens and putting a lens that focuses for distance, computer, and reading is a much better solution because it's a permanent treatment. They can do everything without glasses or contacts. There's no compromise.
Well, I love that you are tailoring each treatment by each person that comes in, where they're at, what they need, whether it's LASIK or the lenses. And there's specialty lenses that we could use for individuals as well, depending upon what they need?
Yes, some lenses are for patients with astigmatism. Some are what we call multifocal lenses, which focuses at different distances so that the patient can drive without glasses, read their computer, and see up close also. So it really depends on the patient. That's one of the main things of the initial consultation, talking to the surgeon, is what's right for that specific patients, because we get patients that have very different needs and expectations, and some patients it's better that they not have surgery at all, while others are better off getting this lens type of surgery versus some others, of course, are better off getting LASIK depending on the age and their requirements, their hobbies, their profession. So,
well, just like the doctor said, the first thing to do is to come in for that consultation, and you definitely can help them no matter what their need is. So, Dr. Diaz, again, thank you so much for letting me come in. I always learn so much, and I know that you guys are definitely going to take care of each of your patients individually. So, thank you again.
Thank you. It's my pleasure.
To learn even more about LASIK and Southwestern Eye Center, you can call 790-8888.